So you guys can see if it's hypocrisy, if it's someone who lacks empathy and sympathy, and these guys are just everything they can do to launder their image. That's all they're doing. That's what they care about. It's about them. It's not about the people of Sierra Leone. These guys are not servants of the people, but servants to themselves. It's about laundering their image. I don't know what this video is about. I don't know where it's trying to get money from, because the money is all drying up. I mean, there's no WHO anymore. There's no USAID anymore and all of that. So I don't know what this video is about, but I want to expose this level of hypocrisy, and you guys will take a look at it, and then we can make a decision, because again, it's not me putting words in your mouth. It's just what I see. When you see young brothers and sisters in the streets of Sierra Leone rotting alive, they're dying whilst they still have a little bit of life left. And the Ministry of Health and that of the Freetown City Council and the Ministry of, these guys did nothing to really save the lives of those people. You call yourself a Minister of Health, and you're seeing videos and young people dying in the streets of Sierra Leone because of, and you cannot do anything about it to save their lives, but yet you come with a video of propaganda here, trying to sell yourself as this wholesome guy who cares about the citizens of that country. I think it's about time people like us, this is what I do. Just call these guys out. If these guys are doing a phenomenal work, I have no reason to not tell them they're doing a good job. But I hate propaganda. I dislike the propaganda, the lies, the laundering of their image to make themselves look good in the eyes of our international partners, when the reality among Sierra Leoneans is drastically nasty. So watch this video for yourself, guys. And this is from my brother's page, Sia Abo. You can follow him on Facebook. Listen to this video. This is a dead body in Sierra Leone in the streets of Freetown. And Austin Demby is the Minister of Health. This is a dead body. And this is not just one. This is not an isolated case. So don't think it's an isolated case. I cannot even put some of the other images on the screen here, but let me play this video so you guys can see how dead bodies are in the middle of the streets and vehicles are going past these dead bodies. But yes, this Minister of Health is calling himself, is illegal, by the way. The whole administration of the SLPP is illegal. So I want you guys to understand that, because they did not win the elections, they lack legitimacy, they lack authority, and they lack power from the people, because there's no result for the June 24th, 2023 elections. So I want to make that very clear. But let's play this video, guys, so you can see what I'm talking about. So let me explain to you guys what you're seeing. Right there, what you're seeing is a dead body. This truck is blocking it down. It is a dead body. That's what you're actually seeing in the middle of the streets of Freetown. This is not one, this is not two, this is not the first case. This has been going on for quite a while. Austin Demby has still been the Minister of Health, even though he's illegal. But what you see there is a dead body in the middle of the street. The youth wrapped up the dead bodies just so the government officials can come get them. Who's responsible for these kinds of things? It is the Ministry of Health. I hear them going back and forth with the Freetown City Council and this and that. The Ministry of Health has a responsibility to preserve and protect the citizens of that nation. They have the responsibility to protect and provide health care for the citizens of that nation. When citizens die like this in the middle of the street, what you're seeing right here, it is the Ministry of Health's responsibility. That's a dead body in the middle of the street. And now, what I want to do for you guys, I want you to you're going to watch this whole video, and you're going to see. When I say these guys are, all they're doing is about London to make the decision together, because I'm not going to call him out by myself, right? I want you to be the decision maker to say, yes, what Ibrahim is saying is true or not true. But I want you guys to see it. Again, this is the Minister of Health, Austin Demby, there in his office. And this is the video that you're about to watch. This is the video of Austin Demby talking about the Ministry of Health. When the basics, because in life, people don't want much. It's the basics. Take care of the basics. That's all people want. We don't want to be seeing dead bodies in the streets of Freetown. The Ministry of Health has been very lackadaisical and careless. And who's in charge of the Ministry of Health? Austin Demby, someone who lived in the United States for so long. This is the problem that we have with these guys. You would think they went to Sierra Leone or they're going back to Africa to fix and develop the continent. But let's listen to this man. Now, have in mind, you've just seen a video of a dead corpse in the middle of the streets in Freetown. It's not the first time. There are multiple of those cases, dead bodies all over the country. The Ministry of Health does not even have a rapid response team to make sure that when these situations arise, citizens are giving the respect and dignity that they deserve. Listen to us in Dembi. I saw this video. I wasn't going to do a live today. I want to relax. But I saw this and I'm like, I'm not going to let this go because I'm just going to do it now. And let us make the decision together and see who's the biggest hypocrite and how these guys are very, very, just out of touch of reality. And we have to bring them back to reality because they're out of touch. They live in an alternate universe and it's our responsibility to bring them back to earth. Let him see this because he's going to see this. He's going to watch this. He's going to see his propaganda, his lies explode right in front of his face. Listen to this.
We're motivated not by the equipment or by the infrastructure, all these different activities. We're motivated by better health outcomes. We're motivated by ensuring that people get the quality health care services that they need, they require for their health. And when you pull all of these together, a physical infrastructure, with the lighting and the water and the energy, you have staff that are motivated, that are competent, that have the skills, have the right numbers. You have a supply chain that has commodities on site. When you bring all of those together, you begin to see radical improvement in the health outcomes.
What used to happen is that people used to go abroad for simple things like CT scans, right? Advanced MRIs, to do diagnostics. These things are now things which we can do in this country. What we have done is we have brought in the most sophisticated CT scan that this country has. Beyond the CT scan, we have high-end ultrasound devices. We have equipped and renovated the mortuary services at Connaught. We are establishing a bonds unit. So with this kind of investment, we are definitely seeing changes.
Most women don't have to worry about their pregnancies anymore. So what we've done now is to ensure that we have active education of pregnant women. We ensure that there's very active community engagement around pregnancy. We work towards ensuring that the pregnancies is delivered in facilities where you have the equipment and supplies needed to support that pregnancy and the delivery, where you have the staff with the requisite training, and you have the equipment and drugs to manage the pregnancy. So when you put all of these to work, you begin to see the kinds of results. So again, having a 76% drop is the fastest drop in the continent. In fact, I would say the fastest drop in the world. But what that means is it's not by accident. It's by deliberate action by the medical providers on the one hand and the community that they serve.
You've seen that, guys. That's what I wanted to share with you. I want to show you that. You see, the focus there looks like it's on the maternal mortality aspect of things, right? But when I say this, we've seen videos of pregnant women in the villages as recently as a couple of weeks ago, where they don't have access to healthcare. These guys are cherry picking. They'll get one institution that is, by the way, not accessible to every Sierra Leonean, because not a lot of Sierra Leoneans have, I would say 90% of the population does not have. Like this hospital with the MRI scan and all of that stuff, 90% of the population do not even have the money that is needed to be able to get themselves access to those healthcare facilities. So like I showed you again this video, I want you to bear this in mind. When we speak about healthcare, it has to be holistic. And it's not a picky situation. Just, okay, look at the pregnant women, or look, they're showing us those wards, talking about the people that we have. Sierra Leone, we have citizens that are brilliant and bright. We have people that are really ready to work. So when you see this video right here of our brother sharing with us. That's a dead body in the middle of the streets of Freetown. So save me and spare me the bullshit. There is nothing you can tell me about the healthcare system in Sierra Leone that I would appreciate. No Sierra Leonean would appreciate, no matter what you say you've done, you have these maternity wards that have, enough beds for newborn kids, newborn babies, or you now have the education and the prerequisite, staff that are there qualified to do the job. No, no, no. You save me the bullshit. This is a dead body in the middle of Freetown. And like I said again, this is just one of many, many, many situations that we've had. This is just one. This is a dead body in the middle of the streets in Freetown. Again, I don't want to show because again, for this Facebook and YouTube, they will take down this old video just for one video. But this is a dead body, and I want you to see it. At least it's protected, it's wrapped up in the middle of the street. Who's responsible? It's nobody else but Austin Demby is the man who's responsible for this. So they are cherry picking the areas that they're going to fight the healthcare. But even the areas that they're showing us, without, aid from the United Kingdom and all these other places, they don't even have the funds to take care of our people because these guys are criminals and thieves, and all the resources that our country makes from Sierra Leone is shipped outside of the country. So they don't even have what it takes to take care of our pregnant women. And it's talking about the sharp decrease in the maternal mortality rate in Sierra Leone to 76% and stuff like that, which is what it's showing. It was trying to tell us there. But all of this, you cannot blind your eyes to these realities of the squish epidemic in Sierra Leone. And this government, the Ministry of Health, has not been able to even provide a safe shelter. Marabio recently went on Twitter, and posted that he visited some rehabilitation center for the kush addicts and stuff like that and this and that. That's a different conversation to have. But what I want to show you guys is this. When Austin Demby speaks like this, I want to show you the Auditor's General Report because it's very important that I show you guys this. And this was a tweet that I did a couple of months ago, where I wanted to share the audit report in Sierra Leone so you guys can see it. And I want to show you what is done in the Ministry of Health, the amount of money and the lapses, how ridiculous and shameful the Ministry of Health in itself, and Austin Demby being the person in charge of that. I want to show you the amount of theft that has gone on, in the Ministry of Health. During the Auditor's General Report, of course, we all know the Auditor General, even them, they are crooked. We have an Auditor General that is not even qualified for the job and is not approved by Intosai, the international organization for audits, auditors across the world. He's not a recognized partner of that organization. But I want to show you the last audit report, and I'm going to read through this because I want you to see the lapses, the thievery that is going on within the Ministry of Health, headed by Austin Demby. I want you guys to see it so you guys would know exactly what I'm talking about when I tell you these guys are coming out here to launder their image. They're coming out here to lie to the world, lie to the people, cover themselves up so they look good. And I'm not going to be the judge because I cannot be the judge alone. I want to share the information with you and you can make a decision. This is the auditor's report. Let us see for 2024 that came out, right? Let us see what it said. It said the non-payment of the withheld taxes to the NRA could have deprived government of its much-needed revenue. But I'm going to leave that, right? Let me go down to the bottom, right here. I want to show you what happened at Connaught Hospital. This is the finding that I want you to see. This is what really matters. Management of medical drugs, reagents and equipment. Connaught Hospital. This was the finding, right? Hospital wards. There, I want to show you guys this because, we cannot let these guys. There was inadequate medical equipment for the examination and screening of patients. During on-the-spot verification at 10 wards and other units within the hospital, we observed inadequate supplies of BP machines, oxygen concentrators, gloves, aprons, thermometers, weighing scales, wheelchairs, stretchers, water heaters, suction machines, cartridges, and accessories for ABG analyzer and MOQ. Guys, then there is no hospital because without all of these, Why do you call it an hospital? Why do you call it a hospital without any of the basic gloves? Austin Demby is in charge of the Ministry of Health. And then you see videos like this one that I just played for you guys. You ask yourself the question, what paradise are these guys living in? And I guarantee you the audit report that is going to come out again. And by the way, I have a very sad news for you guys, because I really wanted to go into the auditor's website and go year for year. And look at this. I just did Sierra Leone audit. I went into Google, did a quick Google search. This is the report. It says Audit Sierra Leone. If I click on this website, the website for Audit Sierra Leone is out. It's not working. Just like the ECSL website, you know, at some point they took it down. The Auditor's General website, the Audit Sierra Leone's website, it's not working. It is dead. So I cannot even pull the information that I really wanted. That's why I went to my Twitter page to look back at some of the tweets that I've made so that I can share with you this. This is one hospital. This is Connaught Hospital. This is the finding at Connaught. Connaught is the hospital in the capital city, Freetown. This is not in some provinces somewhere. This is still in the thieving under the auspice of Austin Demby. Let me show you. I have another page here, another hospital, because I kind of did this, you know, just so, you know, you guys can see exactly what it is. This is another, matter of fact, the continuation from the Connaught Hospital. Continuation from the Connaught Hospital, right? Let me do this way. 133. I want you guys to see this. This is page 133. This is page 132. So I'm going to continue the reading, okay? I want you guys to see this. I've told you everything that is missing right here. Everything that is missing, right? You've seen it. Everything that is missing. Aprons, gloves, thermometers, weighing scales. During on-the-spot verification at 10 wards and other units within the hospital, we observed inadequate supplies of BP, blood pressure machines, gloves, aprons, weighing scales, wheelchairs, stretchers. This is the hospital in the capital city. Matter of fact, Connaught is like the emblem of Sierra Leone. When you say Connaught Hospital, that's what you know for Sierra Leone. Now, continuation on page 133. I'm not making it up. You see, this is page 132. Let's continue of the inadequacies of Austin Demby, who has been the Minister of Health at least for over 4 years now. Let's go to the next page. The next page here, page 133. Let's continue. Let me zoom this in again for you guys. I want you guys to see this. I'm not making this shit up. These guys are insulting our intelligence, and this is what bothers me, right? This is what bothers me. So again, observations at healthcare facility, right? Refrigerators, test kits, blood bags. Let me zoom this in again. I think I've met my maximum here. Okay, cool. You guys would, if you need a glasses or magnifier, you'll read through. All right. Microscopes, test tubes, water distiller, and fridge. Nothing is inadequate. Nothing is adequate in the hospital. Everything is inadequate in the hospital. No supplies. And then you see these guys with these videos talking big talk, laundering their image, wanting to sell themselves as these guys who care when they really freaking don't care. Look at this. In the wards, the bed linens and mattresses are very old. And some of the beds cannot wind, which makes it difficult for some patients with conditions that require certain postures. So the beds cannot be winded. So like to adjust the beds, you know, bring it up, bring it down, giving some patients, you know, they need to sit up a little bit and they need to have their heads back a little bit. The beds are so old, they're not even cranky or whiny anymore. And I guarantee you go to Connaught Hospital today, it's going to be the same thing. Let's continue. They went into the theater. This is the auditor's report. And remember, this auditor is a Mende Southeastern auditor. And imagine what Lara Telopia's findings would have been. But imagine this is a Mende. If you know anything about Sierra Leone, the Southeasterners, these are the guys that are in charge of all these ministries. When you check the Ministry of Health, Austin Demby himself is a Mende from the Southeast. They are all Mendes. So you'll find out about 95 to 98% of the people in these ministries that are occupying serious positions are Mendes from the Southeast, specifically. And they'll tell you, oh, it's calling tribalism. Shut the fuck up. You're a Mende from the Southeast, and you have predominance in the government right now. That's what it is. If you don't accept that, resign and get out and bring somebody else from another part of the country. So shut the fuck up. This is the reality of what we're dealing with, and we're going to call you guys out for what you're doing. Tribalism and nepotism is what caused the rebel war in the first place. So shut up. And we're going to call it out this time. But listen, let's read. In the theaters, there is a lack of special surgical equipment, instruments, limiting the specialty surgeon to do certain procedures. This is what is going on in the hospitals. Triage, that where they accept, admits new patients into the hospital. Triage. The triage lacked adequate thermometers. There was only one BP machine and thermometer. In Connaught Hospital, the National Hospital of Sierra Leone, I would call it. The National Hospital of Sierra Leone. This is what they have. This is from the Auditor's General Report. Again, I'm not making stuff up here. You be the judge. So when you see those propaganda videos by this illegal government, by the way, you will know that you're dealing with criminals and crooks, fraudsters, fakers. They lack empathy. They have no sympathy. And this is why they cannot fix the problems, because they're focused on propaganda only. That is the primary objective. Propaganda all the way through. So let's continue to read, right? Intensive care unit. What is in there? Of the 10 beds in the ICU, out of 10 beds in the ICU, there is only 6 oxygen concentrators and no suction machines. This is why these hospitals are death trap. You go there, you go to die. You go there, you go to die. That is, they're going to fast track your death. No suction machine. Out of 10 beds, they only have 6 oxygen concentrators. The blood bank department. Let's look at the blood bank department in Connaught Hospital. The blood bank department has one refrigerator purchased over 10 years ago. In the event of the breakdown of this refrigerator, the whole blood bank department will be down as there is no spare. Interview revealed that there are no centrifuge and MOQ machines used to cross-matching. So basically, they cannot even match patients for blood. So the blood bank in itself is useless. But yet, Austin Denby gives you this video selling themselves as these guys who are taking care of the Ministry of Health and the Sierra Leonean people. So basically, this is how they will give somebody a contaminated blood, or blood that does not match, because they don't have the machines to match the bloods. So if I'm a O positive and somebody is A positive, and you put a O positive blood in somebody who's A positive, you're going to kill them immediately. And we've heard of many of those kinds of deaths in Sierra Leone where people are dying because of mismatched blood. This is the Auditor's General Report. And then Austin Denby is coming out here doing this video talking nonsense. Instead of them focusing on fixing these problems, they will not. They will not do it. So let's see. In the laboratory lacked an automated chemical analyzer, which is key equipment recommended by consultants as a referral in teaching hospital to be able to do more advanced diagnostics tests. This is the lab where you go get tested. So even in the lab, if you go get tested, they will not be able to pinpoint exactly what are some of the they should be looking for in your lab contents. Your red blood cells, white blood cells, your A1Cs and stuff like that. That is what is done in the labs. They don't even have the equipment to do it in the laboratory at Connaught Hospital. X-ray department. The department lacks computed tomography, a CT scanner. They lack CT scanner, which is what Austin Denby was showing you now, that they've bought a CT scanner. At that time, no CT scanner. In 2024, it's not too long. And magnetic resonance imaging, MRI, scanning machines. Hence, patients with head trauma, cancer, and stroke requiring such service for specific treatments are not having it. Patients requiring CT and MRI scans are referred to private service providers for this service. Dr. Wale died in Sierra Leone because of this. Dr. Wale, a young man, died in Sierra Leone because we did not have a CT scanner, so they were moving him around, and they continued to bang his head around till he died. A whole doctor, I think he was a radiologist of that sort, or anesthetist. I forgot what it was. But Dr. Wale died. He died. And these things have been going on for so long. So let's see what it says. Dialysis unit. We observed that consumables such as filters, salt, gloves, bloodlines, and special plaster were not enough to enhance effective operation of the dialysis unit. Can you imagine that? Dialysis, a very, very delicate process. Very, very delicate process. Very, very delicate process, dialysis. They're not providing it for the people. Now let's move to Rokupa Government Hospital. This is another hospital. We're done with Connaught Hospital. Nothing to write home about. Nothing to write home about. Rokupa Hospital. I think Rokupa is somewhere in the north. The emergency room only has one oxygen machine. Imagine if the capital city, Freetown, the biggest hospital, does not have. What's the situation in the upcountry, in the towns and in cities? The emergency room only has one oxygen machine. This is a grave concern, as there are instances where the one concentrator is used on 3 or 4 patients. Hey, imagine the cross-contamination. Sierra Leoneans, wake up and be serious. You young people, you're unserious. This is going to haunt all of you. You're spending money to attend the video concert when the country, the minimum wage is 800,000 leones. I saw this on a guy's page, Trevor Young. Go check his page, is on there, Trevor Young. The minimum wage is 800,000 leones, but yet you guys are spending 1.5 million leones to go attend the video's concert. These young people, you're the ones that are feeling those. But look at the state of your hospitals. You don't care about these things. You're all going to die from it. I keep telling you this. And it's going to come to a time, there's going to be any sympathy anymore from people like myself. There'll be sympathy for some set of people, especially the young kids. But you that are ages 18 all the way through 30, 40, there is not going to be any sympathy because you guys are not doing what you're supposed to do, to demand what you deserve. You're going to keep dying. Look at your hospitals. There's nothing to write home about. Again, Rokupa Hospital, there are only 3 oxygen concentrators amidst the huge number of patients attended to in the pediatric ward. This is the kids ward now, even the kids ward. So when you see Austin Demby doing these propaganda videos, lying to you all, instead of them fixing the healthcare so it goes across the board, across the country, they're lying, doing propaganda videos to lie to the world, to make themselves look like he's this man who's doing a fantastic job. You're not doing shit, Austin Demby. You're not doing crap. Look at this. And even though breathing difficulties are predominant among other ailments in kids, the nurses, let's go to the next page, guys. Sorry, let's go to the next page. We're not making stuff up, man. We have to call these guys out. 133, 134 now. All right. Let me enlarge this on the screen again for you guys. See that? Nurses are left with no option. Nurses are left with no option than to use one oxygen machine on 2 or more children. In the event of increased cases of kids with breathing difficulties, the hospital would not be able to handle them. Now, psychiatric teaching hospital, Kisi, another hospital, vital drugs like diazepam, used to treat anxiety and relieve muscle spasms and for sedating patients, before medical procedures, mood stabilizer drugs and antipsychotics are not in adequate supply to meet the weekly medical needs of the patient. Patients at the hospital could not be getting the required medical care because of the acute shortage of essential drugs. This is Kisi, Psychiatric Teaching Hospital, Kisi Crescent Hospital. Like they talk about so now. The psychiatric hospital is in Freetown. Now you go to Oladirin Children's Hospital. X-ray facility, that sounds more like a private place, right? So they have an X-ray facility. Unit was not functional for the period under review. Whilst they were there, even the private hospital, Oladirin's Children's Hospital, the X-ray machine was not working. Specialty care baby unit, kangaroo mother care unit. Consumables such as gloves, sensors for pulse, oximeters, and thermometers were in limited supply. The oxygen concentrator was inadequate. You can tell this auditor is being very polite and kind. In limited supply. They don't have it, nothing. Now, the oxygen concentrator was inadequate. As a result, the Y connector was used to enable oxygen connection to more than one baby at a time. Ebo. Then they cross-contaminate. Pikin go die untimely death. The team noted that the unit does not have a water supply and liquid soap to run the unit effectively. Further inquiries revealed that relatives of newborn babies have to fetch water outside the hospital to pay to rescue situation. I'm going to play Austin Demby's video one more time for you guys. I'm going to play it one more time. Because it is essential that you guys pay attention to what is happening in Sierra Leone. Whilst I'm reading all of this, I'm going to play this video one more time from Austin Demby. I want you guys to check this out.
We're motivated not by the equipment or by the infrastructure, all these different activities. We're motivated by better health outcomes. We're motivated by ensuring that people get the quality health care services that they need, they require for their health.
Do you see the lies and propaganda? Do you see the lies and propaganda that I'm talking about? You're motivated by the outcomes. And here I am, I'm reading to you the Auditor's General Report. And this has been successive year after year after year. It has been the same, nothing has changed. And this is Austin Demby telling you about they are motivated by the outcomes and they are using consumables on multiple kids at a time. Look at the report here for yourself. And you tell me what Austin Demby is saying. If it's the truth, he's lying to you. It's propaganda. Consumables such as gloves, sensors for pulse oximeters and thermometers were in limited supply. This is in a private hospital for that matter. The oxygen concentrator was inadequate. As a result, the Y connector was used to enable oxygen connection to more than one baby at a time. And then you look at that video. You see all those babies? That's what they're going through. Cross-contamination, killing these kids before their time. So you see that video and you fall for it. Bullshit. Now, essential antibiotics like cefotaxime, meropenem, and nasal prongs were not available during our visit on 21st March 2024. This is just 2024. Well, now we're about to start 2026 here shortly. You tell me, Brian, when things have changed. It's a lie. Go check the hospitals. Nothing has changed. Go to Connaught Hospital right now. You're going to pay for the pen. You pay for the paper. Nothing has changed. They don't have the thermometers. They don't have enough gloves. They don't have nothing. Nothing has changed. Go there right now and go check and prove me wrong. Go. Infectious disease unit. Again, this is at, let's make sure we're on the hospital. We're on the correct hospital here. This is Oladurin's hospital still. I'm talking about Oladurin, right? You go into the infectious disease unit. The unit does not have a pediatric blood pressure machine and Salter scale. But then you look at the video of Austin Demby, you see all the babies laying on the bed? They don't even have blood pressure machines and Salter scales. Go check those hospitals right now. They don't have it. Eye dependency unit. The unit does not have gloves and oxygen concentrators. Well, man, these guys are criminals, rogues, and thieves, and this is why I do what I do. I'm not on social media to look for fame or be anything. I want somebody else. If somebody else is doing what I'm doing, I'm telling you, I'm out of this. But I cannot stand this level of foolishness and hypocrisy and lack of empathy and sympathy and, mistaking charity for competence, because that is what they've been doing the whole time, mistaking charity for competence. Austin Demby, you would think these guys, because they were overseas working, you think they have some level of competence. It's bullshit, nothing. Look at the intensive care unit at the Olajuwon Hospital. The unit have only one thermometer to service patients. One thermometer. Thermometer. A thermometer. A thermometer. One. These things are like penny to the dollars. But yet the president is traveling, spent over 170 million, according to the calculations of our brother Reggie Cole. What a shame. And Austin Demby is here talking about, what they're doing, and they are motivated by the outcomes. Outcomes, my foot. This is what the reality is. Further inquiries reveal that if they have more than 4 patients, the staff will refer the other patients to other health facilities. So they can only manage 4 patients at a time. Can you imagine for a population? This is why people are dying untimely death. Forget the fact that the people don't even have, the finance to see themselves to these hospitals, because a lot of times people die at home because they don't have money to go to the hospital, right? These guys have nothing, no supplies in the country, nothing. No hospital is supplied adequately enough to meet the needs of their citizens. Imagine if there is a catastrophe, if there's an outbreak of some sort. These guys only rely on international donors. If nobody comes to donate stuff, nothing is going to happen and people will die senselessly, because all their mentality is charity, 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 and they are stealing all of the money out of the country. World Bank recently stated, or IMF said, $700 million was stolen outside and sent outside of Sierra Leone, was stolen from Sierra Leone and sent outside of the country. Over $700 million. Yet our hospitals don't have gloves, and Austin Demby is giving you this fancy video, selling themselves, laundering their image, lying to the world. These guys are crooks and criminals. They should be prosecuted for stuff like this. But who's going to hold them accountable? You have a dead opposition. You have the Abdul Kagbos, the AKKs. These guys are all dead opposition. They talk, no action. Nothing. Not even a protest can be held by these guys. These guys cannot even organize a protest for the sake of their people. Look at what is happening in these hospitals. There is no sharp box in the ward for the disposal of sharp medical waste, and the facility lacked consumables such as gloves, scrubs, and gowns for medical students, staff assigned to the unit. Why is that? Is not a hospital. It should be shut down. What is a hospital without gloves, gowns, and the basics? The basics. What is a hospital without the basics? For God's sake. Guys, so I share this with you because I want you all to see these things. I want you all to understand where we're coming from. I'm not on social media because I want to talk. It's just that somebody has to do this job. Somebody has to call out people like Austin Demby, Minister of Health, even though the administration is illegal. We have to call them out when we see them lying and telling propaganda stories. And those stories are not helping our people, because we see our brothers and sisters on the streets of Sierra Leone dying. And Austin Demby could not even save them. I'm not making it up. This is a dead body in the middle of the streets in Freetown. A dead body wrapped by the people in that community, waiting for the governments to come and give this person a befitted burial, a respectful burial at the minimum. I wonder what they do with these dead bodies when they pick them up. Like, they're so mad, like that it's not their responsibility, that maybe they just burn these bodies or pour acids on them. I really don't know what they do with these bodies. Because in Africa, that is the problem with African people. We don't love ourselves. And it's like everybody's a burden to the other person. Because why? These healthcare workers don't even get paid properly. So for them to do their jobs, I mean, it's like a burden to them. Now you're dead in the street. They have to come carry you. They have no respect for your dead body. I'm sure they come with a truck. They just pick up this dead corpse and just throw it in the truck. Say, look at another one, useless one. When they forget that the same system that is beating them is the same system that has beaten down this person and failed this citizen. The government failed this citizen. It is a sacrosanct fact. That's a dead body. So before Austin Demby comes out and wants to do more videos and talk crap and bullshit, I think they have to know that there is a reality. And this is what, journalists in Sierra Leone fail to do. And let me show you guys a video of a doctor who tried to call out, these guys and see what they did to her, right? Dr. Catherine. I want you to see this video. Austin Demby, let me remind you, we have these videos. I want you guys to watch this so you guys can see what I'm talking about, okay?
So my assault was based on an assumption from some random person that was within the minister's group from the Ministry of Health, saying that I want to post that video online or on social media. And so five big men just...
This is the reality. This is what we're dealing with. This was Austin Demby. Some of his officials, they beat up this doctor because she was recording. This is the same Austin Demby where they were not paying contractors to clean up the Connaught Hospital, and the Connaught Hospital was nasty. This is the same Austin Demby. These guys are the most inept that you can ever find in administration. I'm not making shit up. So for Austin Demby to come out here and put out this propaganda video, it tells you everything you need to know. You guys remember these images? Filthy Connaught Hospital back in 2021. See the filth at Connaught Hospital? God knows what is happening there right now. And this is what they don't want when people share this kinds of stuff. Look at the Connaught Hospital. This was in 2021. No excuses. August of 2021. They were not paying the salary of the cleaners at the hospital. Look at the garbage at Connaught Hospital. Connaught Hospital of all. This was in 2021. But I'm just telling you who he has been. And when you want to report these things, they go after people and beat them up for that. And this was another doctor who reported this. This is Connaught Hospital this morning. Nurses have been cleaning their respective wards since Tuesday. I don't have strength to write long epistles. The country's only referral hospital for medicine and surgery needs help urgently. This was a doctor calling out for help. Dr. Dalinda Jiba. Hey, guys, we have the records. Hey. So sometimes I just say, you know what? I can't do it. I'm just going to let it be. People need to pay attention. Let somebody else say something. But I wanted to share this with you. I saw the video of Austin Demby and I was appalled. Austin Demby needs to shut up, go and do the work, and let the result show itself. When you've worked, you've worked. Let the result speak for itself. Shut up. Don't do propaganda videos. If you've done the job is going to speak for itself. And I'm going to close this live in the words of Professor Lumumba, guys. And I'm going to close this live in the words of, Dr. Professor Lumumba. When you work, let the work speak for itself. You shut up. Austin Demby, you need to shut up. I don't want to see any more propaganda videos from you guys. Let me play this so you guys can listen to this.
You know, I've always said when somebody says that they have done something and they have to spend 1 hour explaining what they have done, then they have done nothing. When you have done something, you shut up. The things that you have done speak for themselves.
That's it.